Hello everyone. Today I'm going to present a study toward supporting adaptive training of injection procedures, detecting difference in the visual attention of nursing students and experts. My name is Ming Hao, and the co-authors are Bing Zhen and Carrie DeMonzap. We are from the University of Alberta. First, I would like to give a brief introduction of the motivation of this study. Every year, there is a large number of needle injuries happen globally. Most of these injuries are the result of human factors, with the inadequate attention management being a key factor. This suggests that it is necessary to improve attentional behavior when teaching healthcare trainees on how to deliver introductions. Prior research has observed that experts have a better visual attention process than non-experts in their own domain. For example, the expert referees in the football can direct attention to a certain area of player bodies to quickly detect an infraction. Um, and recent research suggests that such gaze behavior was developed as a result of being learning and practice. Then how we can capture such expertise related behavior? Eye tracking is a rapidly developing technique and could help solve this problem. It provides us the insights to visual attention characteristic and the latent cognitive processes governing their performance. For example, in healthcare field, in the radiology image reading task, the expert and novice will have different coverage in gaze scanning patterns because the expert know that the abnormality will commonly happen in certain areas. Such kind of data detect will help us detect the expertise for the purpose of adapting learning design. With such motivation, we conducted an analysis of eye tracking data when participants performed injections in a simulating injecting setting. The data were collected in a lab-based experiment. All participants were recruited from a nursing school. They were asked to wear a glasses-shaped eye tracker, the Tobii glasses, and each participant will perform 3 trials of injections with the preloaded syringe and on the simulated pad, and no feedback will give during the task. And in our analysis, we got eye tracking data from 18 participants in total, including 8 experts who were educators and physicians, and 10 third-year nursing school students. And will have students who took 3 hours practice laboratories on injection safety before the experiment. In this study, the injecting including 4 stages. First, the initial preparation. The participant will observe the workspace, inspected the material provided, and in the second stage, we call it pre-injecting stage. The participant will observe the panel, put their non-dominant hand on the pad, and sterilize the area to be injected. Then in the third stage, the participant will start injecting, and after that, they will withdraw the syringe after finishes. The final stage will the participant will dispose the syringe and finish the task. And in this analysis study, we're focusing on the participant's gaze behavior during the pre-injecting and injection area, just 2 stages. The area of interest for this study, the LI, was defined manually within the participant's view. And in the pre-injecting stage, we have 5 areas: the fingers, the palm, thumb, pad, and the ambient areas. In the injecting area stage, we added 2 more areas, including the dominant hand holding the syringe and the injecting site. And that's the point of injecting. Next, I would like to introduce the key measures of this analysis study. For attention location, first we'll calculate the duration of participants spent looking at a certain area of interest by summing the fixation of area AOI's coordinate in a stage. Such measurement is called dwell time. Second, the percentage of the total dwell time within AOI will help to confirm the relative importance of a certain AOI to a participant. Then we have another group of saccade-related measure. First is the saccade amplitude, showing the distance between the central of the fixation that precedes the saccade and to the central of the fixation that follows the saccade. And the second measure is the relative saccadic directions, which is showing an angle in degree between two consecutive saccades. In this analysis study, the mainly dependent variable is the level of aspartame, and we perform three-way mixed ANOVA to test for the difference in the reported measures. Then I would love to introduce our main findings. We found experts and students had a different strategy for attention allocation during the task. We noticed the student has a safety-oriented mindset. During the pre-injection stage, the student paid more attention to the finger, which is the area that most easily got needle stick injury. That means they tend to focusing more on selecting the point that might help them avoid the hurt. However, Asper had the target-oriented strategy. They spend approximately twice as much time focusing on the thumb than the novice, and spend more time looking at the thumb during the pre-injection stage. The interpretation of such pattern is that the Asper would use the thumb together when their eye rapidly searching the target relevant regions. We also found Austrian students had different saccade management patterns. While the saccade pattern of the student remains stable, the Asper has a gauge jump valley across the stages. They tend to have longer gauge jump in the pre-injections and shorter jump when injecting. This may show the experts are better able to quickly direct their attention to the relevant location while ignoring the distracting and irrelevant information. We also noticed that both groups did not pay attention to the ambient area or needle point during the task. That means the participant might have focusing on the thing that could be hurt rather than the tool that could cause harm. And the vigilance about injury may occur at the early stage and incorporate information from the proprioceptive sensory system. Finally, I would like to give a summary of this work. From this study, we found using gaze data can detect expertise level and help inform the student modeling. The analysis reveals the difference of attentional pattern based on the task stage and the expertise level. It shows the possibility to address the instructional approaches in the simulation training, like give the student explicit guidance on where to look at. And one challenge remains is that how and when we can present this kind of guidance. So thank you so much for the interest and attention. Please feel free to email us if you have any question or insight of our study.